Okay, we're live. Yep.
Hi, welcome to Warrior. We're practicing or demoing a ClearLift facial today, which does collagen remodeling and facial toning. Let me know if you have any questions. We're going to go ahead and start.
Don't look.
Start with your forehead. How are you feeling? Fine. Good.
What does it feel like?
How to describe it does not hurt, that's for sure.
It doesn't hurt. Great.
No,
Okay.
not at all.
Oh, good. Val, can you talk about a little bit about what your process is right now?
Yeah, so what we do is we go ahead and do a total of 3,500 laser pulses to the face. And then we're going to go ahead in each area and do a certain number. So we'll do about 500 to the forehead. And then we're going to move on to another area.
And what is the goal in this treatment?
And the goal is to help with collagen remodeling and facial toning.
You have to speak up a little bit. I guess Dr. Tim Romanowski just came by and said, we can't hear you all the way on the video.
Okay.
So,
So collagen remodeling and facial toning is what this procedure does for people. And it feels like a really nice facial.
come a
Debbie
little
here has
closer.
had one done before. How would you say you felt afterwards, Debbie?
Oh, terrific. And the face just glowed for days and days. I didn't have to wear any makeup.
Wow.
Yeah, she's saying that she didn't need to wear makeup. Her face was glowing and just felt amazing for days.
And also, if we didn't hear earlier, our patient, Debbie here, has said that she is experiencing no pain with the treatment. It is hard to describe the way it feels, is what she said earlier, but it's definitely not painful, is what she said. And Val, nurse practitioner Val, is performing the treatment. And it doesn't even look like it's touching the skin. Is that right? It's just
Yeah.
hovering above.
Just hovering above.
Yep, with that laser. And what is this machine called and the treatment called, Val?
This is the Harmony machine.
Harmony,
and
okay.
This is made by Alma, and it is a ClearLift treatment.
Okay, ClearLift treatment by Harmony and through the Alma group. That is the machine is made by Alma. You got it.
And the nice thing about this is you can do this in about 15 minutes of your lunch break. And if there's any redness, it would not persist for any more than a couple of hours. I've had this done myself and have found that I'm red very easily. I'm probably red now. I'm just flushed very easily. And I was probably only slightly red or pink, I would say, for about an hour afterwards.
Oh wow! And
Yeah.
so this is not the treatment I saw you after the other day.
No, it's something we were demoing
Gotcha.
that we had not done yet. We have not bought.
So I'm Stella, and I only through a friend, and then I looked stuff up on the internet.
In pain right now?
Not at all.
This is really okay. I'll tell you all about it. It was so nice to meet you. Have a great rest of the day. Yeah, that's it.
Does this Harmony machine do other types of treatments, Val?
It does. It's wonderful. We like it because it's a jack of all trades. It allows us to do tattoo removal,
Oh, wow.
laser hair removal, and then there's another process called the dye VL, which helps deal with actually deal with redness. So people have just red undertones in their skin.
Sure.
Also helps with skin tightening as well. So a lot of times we'll couple these treatments together, like the DiVL and the ClearLift. We can do back to back.
Nice.
Takes about half an hour to do the whole procedure.
Does it treat any like dark spots or scars or anything like that?
It treats dark spots and
Okay.
a little bit of the scars.
Okay.
And then we also have something called a VascuPen on this. So if you have any broken capillaries on the face,
Yeah.
on the nose, lips, mouth, chin, cheeks, then
Yeah.
it'll treat those on the spot.
Oh, that's
and
cool.
they'll disappear immediately.
Oh,
which
I've
is
got a
just-
couple of those. Interesting.
Just
Okay.
magic, honestly.
Really cool. Wow, it is like magic.
Come around to this side.
Little magic wand, Harmony.
Come down to this cheek. So we separate each area. So 500 clicks on the forehead, 500 on the chin, and we're doing 1,500 on each cheek. And then we're actually going to treat her neck as well.
Okay. So you see results after one treatment. Is there like a series of treatments that you recommend for like,
Yeah, we usually recommend 4 to 6 treatments, and we do about once a month.
oh, okay.
We can do it back to back like that.
And then
just to
after
help
6 treatments, are you completely like done or do you come back
I
like,
think it depends on
however?
where
Okay.
you want to go and what your skin type is like. So the nice thing about this device also is we can treat pretty much any skin type. So there's something called Fitzpatrick skin types, and we can adjust the laser to treat all different ones. So people with darker skin, we can still treat and not cause damage, which is our biggest concern.
Mm,
It's going to be a little harder. How do you feel, Debbie?
Oh, everything's fine.
it's interesting because you didn't have to put numbing cream on, did you?
No, she didn't
Nothing?
do any numbing
Wow.
cream for this.
Because I've done treatments where I've definitely had to do the numbing cream beforehand, or else it would have been really, really
Yes.
painful. So that's
Yes.
really interesting. There's no pain.
Yes. We actually demoed a piece of equipment that we're thinking about bringing on in the future called a CO2 laser. And it's a cool peel, but you really, you could get through it with no numbing, but they had a higher powered one where you could do 1 treatment instead of 3, and that one you absolutely needed numbing for.
Yeah.
So, and then I was red for, I'm easily red, but I was probably red for a good 4 days afterwards.
It's funny because I saw you and you had done the same day as 2 other people in the office. They
Yes.
were not red like you, but you
Yes.
were very sensitive
Yes.
and get red. Yeah.
Definitely have sensitive skin.
Yeah. I do have sensitive skin as well. Luckily, mine is not red. It's not one of my many skin problems, but I've got plenty of others. So.
Okay, great. I'm gonna work on her nose and chin.
Let me know if I need to pivot like backwards at all.
Okay.
Just if I'm in your way.
On the nose, the upper lip, and the chin. And
Okay.
then we'll do another session for the neck area. We'll do that in 2 separate sessions.
Okay. Is that thing heavy?
No, it's really not. I'm just trying to be precise.
Sure. I just didn't know if
Yeah,
operating
no,
it was difficult. Just curious.
Not at all.
Now, does it help with fine lines, did you say?
Yes.
So this is good for like women who have that like around the lip like lines. I feel
Yeah,
like a lot of
because
women.
you
My
know,
mom
if we're
complains
smiling-
about that.
Smiling a lot and being joyful, then sometimes we get lines to go with it. So when I do chemo, my hair goes back a bit. I started growing back. I had cancer in 2017, 2018. It's just like, cancer patients.
Is this also the treatment that brings out color in your lips too? Or is that a different one?
Yes, there is a protocol to do that, to plump the lips.
To plump the
And
lips.
then actually do the color as well.
Yeah, just be careful.
Okay, I'll show you right here. So right here, this is where the head goes on. What we do is we
So it's you're not doing that treatment right now. It would be a different, it would
It would
be
be a different setting.
setting.
and
That's
number of
neat though.
treatments,
I
yeah.
didn't know it did that until today.
Yeah, it's great. I mean, it does so many different things. It just makes life easier. That's why we like this device, because we're a primary care practice at heart. We wanted to offer some things for clients or patients that they could do here and that are really non-invasive.
Yeah. I'm just gonna adjust my vantage point here.
So did I see Debbie?
And why are we all wearing glasses?
To help protect our eyes from the laser.
Okay, so even though we're just seeing like the reflection of the laser
Yes.
on her skin, it's still
It
that.
can be damaging
Okay,
to the eyes if we're
interesting.
not careful. Right, sorry. I try to contour as much to the face as possible.
Sure.
Best application. I'm gonna do some speed back here.
Will we be able to
Yeah.
post before and afters later of
Yeah,
Debbie?
absolutely.
Yeah.
I'm sorry, I'm trying to squish back here and get your neck now. Thank you. I don't think we've done your neck before. How does it feel right now?
Oh, it's fine.
Not too spicy?
Nope, everything is good, and I thought when I first had it that I would heal. There was absolutely no feeling whatsoever.
That's amazing. Yeah, the CO2 laser definitely peeling with that. Itchy face peeling, but I felt the same way too after my treatment.
It's amazing.
And we have some really nice products that kind of help just nourish the skin, calm any inflammation at all. It really takes it right out, which is really amazing, especially, like I said, for the red skin people like me. And this can also work on the décolleté. So if you have sunspots, trying to get some of that wrinkly, I don't want to say wrinkly.
No,
but like,
it's crepey. Crepe.
crepey skin.
Yep.
Especially after being sun goddesses most of our lives, most of us. So
Yeah, I've noticed like even like my cleavage area, like I'm only 43, but I'm starting to get like a little bit of crepiness there.
yeah.
So, it, might be nice to plump that area back to some youthful lookingness.
The nice thing is it'll tone out some of the skin under the neck too. Debbie is pretty fortunate; she doesn't have a lot of loose skin under her neck. But I think a lot of us kind of start to get that turkey neck feeling as we get older. No matter
Sure, a
what
little
we do.
droopy, like it's not as
Yeah.
quite as like up right
Robust
by your
first
chin.
when we're
Yeah.
20, what we didn't realize we had, so we were so lucky to have at the time.
Well, what I noticed for myself was that I had gained and then lost weight, like with pregnancies and everything else, and
Yeah,
like
absolutely.
that. I think weight, it doesn't bounce back after you've had like fat there.
Yeah, and it's hard to lose that fat in those places.
Sure.
I'm gonna do the other side of her neck, and then we'll be done.
And for those of you who are just joining us, we are doing a Alma Harmony ClearLift treatment on our patient. The patient has shared with us that she is in no discomfort or pain, and that this treatment's results we will see almost instantaneously, and that it will last however long. It's kind of like individual results vary, right?
Absolutely.
And lots of times I'll do these once a month for 4 to 6 months, and then the patient can come back if they want to see any other improvements. And we're building collagen, removing, trying to help alleviate fine lines, helping with the elasticity, and anything I'm missing, Val?
No, I think that's all.
Okay.
your skin feels warm at all, or?
Not, but maybe just a tad bit.
Okay.
Tad bit warm. Okay, interesting.
So we have this little, I don't know if it can be seen on camera, but this little horseshoe at the end that the laser's pointing through. And sometimes that's nice because it feels cooling, but we kind of, we try to not drag it on the skin too much because that can be more uncomfortable, I think. Would you say that's the case, Debbie?
Yes, absolutely.
Yeah. So trying to hover just above the skin, the best result that way. 16 hovers of kilojoule left.
Awesome.
All done. Wonderful.
Well, we are still live. I'd love to hear, now that we're done, from Debbie, our patient, how...
How you're
It
feeling?
was fantastic.
Okay.
I want to get the whole body done.
Yeah, you want to laser your whole body. Okay.
Absolutely.
All right.
And there was absolutely no pain.
Nice. That's
None
awesome.
whatsoever. And it was, I don't know what to say, it was just fantastic.
Okay.
It was a pleasant experience.
That's great. Well, thank you for everyone for watching, and we'll
you.
post some before and afters of the treatment. Thanks, everyone.